Good morning, good afternoon, and welcome to this new TechNet webinar, the fourth one in a series of 5 on data use research led by JSI and Sonder Design Collective. The topic today is how WhatsApp is transforming communications within the Kenyan healthcare system. And we're happy to have again with us today Wendy Prosser, Isaac Mugoya, and Natasha Kanagat from JSI, and Emilia Klimiuk from Sonder Design Collective. During the presentation, you can submit your questions in the Q&A field or in the chat field, and the panelists will give you some answers at the end of the presentation. As usual, we are recording this webinar, and the video will be posted on our YouTube channel as well as on TechNet. We'll provide the link to it and to the presentation on the TechNet forum. You will also find it on our webinar page, and I'll give you the link in the chat box in a minute. Okay, Emilia, the floor is yours.
Thank you very much, Alex, and thanks everybody for attending. As Alex mentioned, the webinar today is focusing around how WhatsApp is currently being used as kind of a communication and data sharing channel in the immunization program, specifically in Kenya. And just before we start sharing those insights with you, just a little bit about the project and where these insights are coming from. So the project we're collaborating on is the Vaccine Data Insights Study, which is a joint effort between Sonder Collective and JSI. And we're using kind of a unique approach here. We're using a human-centered design approach which basically means we're focusing more on one-on-one conversations with individuals at these various levels of the system. And our goal here is really to uncover pain points and challenges from the perspectives of those healthcare workers and managers at the different levels in the country, and to really develop empathy for the point of view and understand things from their day-to-day lives. And so the work we're doing is in Kenya, the DRC, as well as Mozambique. But the findings we're sharing with you today are specifically from the work we've done in Kenya earlier this year, where we've gone to 3 different counties and spoke with 84 participants total. And Natasha, you can move to the next slide. So as we've mentioned, what we've really seen as we've had these conversations with the different healthcare workers and managers at the various levels of the system in Kenya, one of the things that really jumped out at us is how WhatsApp is universally being used by almost all of the participants we've spoken with as a very key tool for sharing information and interacting with all of the different actors of the system. And this is true both in terms of peer-to-peer interaction, meaning a nurse speaking with other nurses, as well as kind of at every level of the system, meaning facility level staff speaking to each other and to other facilities, as well as kind of in verticals. So thinking about, the surveillance team members speaking to each other from the sub-county level all the way up to national. So it's really kind of a universal tool that allows people to be able to kind of go beyond their traditional reporting structures of only talking to their supervisor and have this unofficial channel where they're able to kind of more dynamically share information. And so the way we've seen, and maybe something else to note, is that in our work in Kenya, the use of WhatsApp was universal across all geographies. So we've gone to urban sites, peri-urban sites, as well as more rural settings, and the use of WhatsApp was consistent across, and it was also consistent across genders and as well as age. So young people were just as likely to use WhatsApp as older nurses, and preferred to use the channel over phone or paper-based kind of communication. So just to note that we did not see any kind of evidence of this being something exclusive to young people or exclusive to urban settings, at least in Kenya. And so there's 3 different ways in which we see WhatsApp being used. And so we're going to go through those 3 kind of different uses for WhatsApp. I'll start us off with the first one. So the first way we've seen WhatsApp being used is really as a way to share information much faster. So of course, we all know there's formal channels like email and paper reports. And I think there's an obvious challenge around data is usually needed much faster than it's able to travel through those slower, more formal communication channels. So the needs of the system are often to have real-time data, and WhatsApp provides a way to give that to the decision makers almost immediately as when they need it. And what we saw is that this the WhatsApp reporting, as we're calling it, helped to bypass a lot of the common challenges around transport not being available, or money for transport not being available, long distances between, let's say, the facilities and the sub-county offices, and as well as staff shortages that makes that handling of physical reports much more of a challenge. So we've seen this as a way to kind of bypass a lot of the very common and top of mind challenges around data collection and data use. So some specific examples for how we've seen WhatsApp being used as a way to share information faster. It was very common around the HIROs at the sub-county level, the records officers, who are in charge of collecting the data from the facilities and then keying it into the DHIS2 system. So what we've seen is they're really using it as a way to when they find errors, they will quickly follow up with the facilities, which might happen on the phone, but then they will request to get a corrected report through WhatsApp. So we've even seen, anywhere from taking a picture of the corrected report that is able then to be directly keyed into the DHIS system. And we've even seen examples, as is pictured here on this slide, Excel documents being shared as attachments and being passed back and forth with the data being corrected. This was at a larger facility, which I think has a dedicated records officer who was able to handle this. But it's really seen as a way to correct data very quickly and in real time, and kind of expedite this correction problem, which the records officers struggle with. And then a second really strong usage around using WhatsApp for information sharing is in the surveillance team. So the surveillance team has a higher appetite for this real-time data because it's obviously very crucial for them to know as soon as there's an outbreak, they need to know. And so they are receiving weekly reports from the facilities. And obviously, because of the transport and other challenges, they are actually using WhatsApp to send pictures of the paper reports to the surveillance officer. So the surveillance officer is getting all of the facility reports on a WhatsApp group where everyone can see it, and they're logging the information, and they are the ones then to aggregate it and key it into the system and forward it up. Should they notice any issues, any unusual cases, they might follow up using WhatsApp with the different facilities or call them directly. But then if they find an outbreak or something to be concerned about, they're immediately sending off WhatsApp messages to their supervisors to notify them, as well as kind of everybody else in the sub-county management team, to let them know very quickly that there's an issue. Okay, so then the next example of how WhatsApp is being used is as a stock management tool, so to kind of help with ordering and managing of stocks at all levels of the system, actually. So what we've seen here is that there are all of these different tools that the managers are supposed to be using to enter in data. But what we found is that the usage of these systems is actually quite poor and inconsistent. So oftentimes, in Kenya, there's a choice. You can either order using a digital system or you can order using a paper form. And what we find is that people find the digital system is not very reliable and favor the paper-based forms. But what you'll see is that they will then take pictures of those reports and send them upwards and kind of communicate that way to expedite the process. So in a sense, they're creating their own alternative digital system for ordering. What we also see is that it's being used very often to organize logistics and to kind of deal with challenges around kind of uncertainty of knowing when the stock is actually going to arrive at the region, and when you need to organize all of the different sub-counties to pick up the stock, as well as kind of troubleshoot any issues around transport. So this was especially true. There's one county we went to where the regional storage facility was actually, the fridge was not working. So the region had no ability to store the stock. And so there was this very robust system for organizing all of the various sub-counties to come in, organize their transportation, and pick up that stock immediately in very short notice. And this was all done through WhatsApp groups and kind of these unofficial logistics channels that were created through WhatsApp. And I will hand over to Natasha for the third way of that WhatsApp is being used.
Thanks, Emilia. So the third way that we saw that WhatsApp was being used was as a mechanism to interact with and motivate either each other as peers or between supervisors and those that they supervised. Now, as we know, supportive supervision activities are often under-resourced, which means that they do not happen as per a regular schedule, and therefore there are fewer opportunities for engaging and conversing across multiple levels of the system, except when it's time to send reports up. So, the other thing with supportive supervision activities is that they are usually very structured and can be seen as being, more evaluative and following a very sort of an organized checklist that needs to be covered from start to end. And something this structured often leaves very little room for a conversation around what's working, what's not working, what can we change, how do we shake things up, etc. So in this situation, WhatsApp was used by many supervisors as a mechanism to motivate teams to share information about, something data that was maybe needed, or a way of making data more transparent. So either discussing data, requesting data, sharing thoughts on the data that was shared, etc. And it also allowed sort of data validation at the peer level. So, even when somebody, for example, we heard that when a nurse shared some data with her supervisor in a WhatsApp group, other peers jumped in to also interpret what the data meant, what it said. They reflected on their own data around that same topic. And it sort of began this organic discussion around what the data was, what it said, where it could go, etc. So as we see here, so another interesting thing that we learned was that, it was also sort of it sort of bypassed some of the formal reporting structures that have an air of formality to them. When an email is sent with a stamp of finality on certain data, it sort of creates almost this mental space where, okay, this is done and now it cannot be changed, and it's sent to the next level for review. But WhatsApp continued to allow a space for an ongoing engagement and ongoing discussion around data, and it offered opportunities for feedback. Sometimes people also just shared inspirational quotes with each other, something touching, personal, funny that they found was shared around. So it sort of fueled both sort of the building of professional relationships outside the bounds of the formal structures, but also brought in a more personal angle that allowed people to get to know each other as humans. And then, so it created a support network, and there were multiple subgroups within WhatsApp. So you had like a nurses group at the facility level or HMT groups at the sub-county level. And all of these subgroups also supercharged those communications and that exchange of ideas and experiences, or even in some cases, troubleshooting and problem solving in a way that was rapid, instantaneous, and went beyond sort of a one-on-one conversation because it was in a group setting. So it allowed for more ideas to come in. So, we've just shared sort of 3 quick snapshots of how WhatsApp was being used, or is currently being used rather, in Kenya. And now we come to sort of the so what. So we know that it's used to supercharge communication, as a stock management tool, and then also to sort of facilitate conversations and sort of a supportive supervision interaction. When we come to the so what of it, how might we sort of formalize the already widespread use of WhatsApp in Kenya so it can play sort of a pretty big role in digitizing reporting, where, we are already headed in that direction. So, and seeing the rapid growth of WhatsApp as a tool, how might we actually formalize and institutionalize perhaps the use of it so that it enables the system to also bypass some of the resource-related constraints around hardware and transport to drop off a report, etc., and really enables sort of that rapid sharing without some of the more entrenched challenges that we hear about. And then, the second thing is, WhatsApp really did and can continue to facilitate sort of a multi-way conversation around the program. So one of the things we've heard often is that, information flows in one way up, and that there is a persistent sort of request or need to have the information flow back down through multiple channels. And WhatsApp offers that opportunity to build on it and to actually have those ad hoc, organic, and also structured conversations around data and the program in general. So these are just a few ideas that we wanted to put forward for some conversation on this webinar and beyond. So I'm going to pause here for a second to see if Isaac or Emilia has anything else to add before we move forward to sort of the Q&A portion of this.
I'm good, Natasha.
I think maybe the only thing I would just add is that I think what we're really seeing here is that WhatsApp is being used as a tool it's kind of a bottom-up approach to problem solving. And so you really see that there's these challenges that I think we all know about by now around transportation, around airtime issues, around issues of staff shortages. And a lot of times what you see is that from the facility level up, there's people who are trying to solve these issues, and they're actively sharing these solutions with each other, and they're kind of coming up with their own hacks and ad hoc approaches, which coincidentally is the topic of our next webinar. But there's these efforts to solve issues on their own, and WhatsApp is really a very powerful tool for them to do that, to either find the right person who has the information they need, or find the right person who can help them, or find the data that they need. And so it's this very kind of flexible tool that's being used by all system actors to kind of make this quite rigid system much more flexible, and make data that's traditionally lagging more real time.
Yeah, thanks, Emilia. So as Emilia said, we, invite you to also keep in mind our next webinar, which is going to pick up on one of the topics we just raised, which is ad hoc health facility tools and workarounds, which is on August 13th. And we'll send out reminders about this. You could also download our initial sort of Kenya Insights report and read our blog series on Medium to learn more about what we've found around all of these topic areas that we've been hosting these webinars on. Now we'll move on to the Q&A and chat. I see some questions here already, so I'm just going to start calling those out. Okay, so the first one that I see here under Q&A is from Sohini. Usually, WhatsApp is still not viewed as a very reliable documentation tool. And many still prefer hard copy or at least an email that's easier to achieve. Did you face any challenges in convincing stakeholders that data being shared on WhatsApp can be used as official documentation? Emilia, do you want to take that?
Sure, I'm happy to take that, and also I'm sure Isaac will have things to add. So the first thing I'll clarify is that in our work we are not we're not convincing anyone of doing anything. So this was a very exclusively research project. So we're not implementing solutions. We're not even going as far as creating official recommendations. This is a very kind of formative study to understand what is happening at the ground level and what are the current behaviors that people are already exhibiting. So this is what we've shared with you are actually things we've observed people doing at all of the different levels of the system. And so we did not hear of anyone kind of expressing a concern that there is, that this is not a formal channel. I think the way I would say what we've seen is that WhatsApp is not replacing the official communication channels. I think what we've seen is that there's very kind of clearly defined roles for the different channels, for the paper, for the email, for the WhatsApp, and for phone calls. And they're all being used for different purposes. And the use of one does not replace the other. It kind of supplements. And so what we've seen is people will say, papers for the very official, for the formal, for things that were required to submit to national. Email is used for official communication with your supervisors. If you need an official trail, you use email. WhatsApp is being used kind of to supplement these two and to make information sharing faster. So it's being used alongside. So no one's saying replace paper records with WhatsApp. What they're saying is, I'll send you the paper record, but you might get it next month. So here's a picture of it, so you can act on that data today. Isaac, is there anything else you wanted to add, or Wendy?
Yeah, I think thank you, Emilia, for that input. I agree with Emilia totally. My addition is that, as Emilia said, we did not. It was a research. We were not trying to see that people, and even when we started, we didn't know that we would find what we found. So we were not trying to convince people to use WhatsApp. First, WhatsApp is used by everybody. So, and in that, I think people have seen potential, and that's why we're using it. And the potential in WhatsApp is, I think it's, for me, two ways. One, there is that timeliness of data. There's some data that needs to be sent timely. There's some data that can wait until the end of the month. For WhatsApp, I think that gap of timely data, that's what it has come to solve, especially the stock data, the surveillance data that needs to be reported almost immediately. That's why it's filling. The second thing is peer-to-peer, in the sense that when I send information, people belong to several groups. And when that information is posted on WhatsApp, that information is seen by so many people, not just one person. And I think in one of the counties, I think it's one of the sub-counties, where the head record officer was saying that when they receive this data, I think it's one of the counties, account at county level, when she said, when she received this data, she lets the sub-county HRIO, the head records officer, to communicate and comment on data from each. So they are able sort of to critique each other. And in this, they also build each other's capacity to do what they're supposed to do. So that is the role the WhatsApp comes to play in. It will not replace the official channels. And we didn't find anybody who was opposed, because we found this WhatsApp group being used at all the levels, national, county, and sub-county. Yes, over.
Thank you, Isaac. Thank you, Emilia. So we have two questions that are related, and they are essentially around whether we encountered any conversations around connectivity issues in either hard to reach areas, remote or rural areas, and whether there was any discussions around, the ease or the difficulty of using WhatsApp because of data signal issues or internet connections.
I'm happy to take that one. So we did not go to extremely rural areas, but what I will say is that WhatsApp is actually kind of uniquely positioned because you don't need to send data real time. So even if you're in an area where your reception is not quite strong, you can still send the information, and then when your phone connects to the internet next time, that information will be passed on to the next person. So in that way, it's actually set up quite well to deal with network issues, unlike some other tools which are more real time. And so in some ways, it almost functions better than trying to call people over a poor network. You can just send the message, and when your phone is connected to the network, it will go to the person who's waiting for that. We did not hear anything around connectivity issues, but just to acknowledge, we have not gone to the very remote areas where connectivity might be a bigger issue. And I think the related question that I also see in the Q&A is around who do we see using WhatsApp? Because I think it's the double accessibility issue, skill, as well as kind of the availability of network. In terms of who was using WhatsApp, honestly, every single participant we've talked to, so we talked to 84 people for this Kenya study, every single person was actively using WhatsApp and had no issues with using it. They were using it for both personal reasons as well as for work. For most of the participants we've spoken with, every person we asked was a member of at least 4 up to even 10 or 12 different work-related WhatsApp groups with peers, with people at their system level, facility, sub-county, county, national, or vertical, meaning a nurse, and then her supervisor, his supervisor, all belonging to the same WhatsApp group. So in terms of usage, I think this is very significant. There's no issues around gender, no issues around age and geography. Everybody we talked to was actively using it and didn't really seem to have any issues around understanding the technology. Over.
Thank you. And then we have, 2 questions here related to sort of the administrative burden as data gets reported up. So the first one is, use of WhatsApp for reporting can increase timeliness of reporting data from lower levels, but at a certain point, it may mean increasing administrative burden on a higher level. And did you find pushback from those working at that level whose data entry burdens may have increased? And I'll go ahead with the second one because they are related, which is, I would like to know if there was a specific strategy or approach to reach, there was, the related one was actually, we've already merged that in. So I think I'm gonna pause here to Emilia to again let you or Isaac sort of share any thoughts around synthesizing data and moving it and hearing from those at higher levels who then had to compile or manage or organize at their end.
I know we're short on time, so I'm curious actually to hear Isaac's thoughts on this, but I'll really quickly say that pushback again is kind of not a good word for us, because I think from our point of view of cataloging things that people are already doing, what we see is it's a tool. WhatsApp is a tool of convenience. Meaning I have a problem, I'm solving it with this tool because the official channels are not working for me. So if we see people at the national and county level using WhatsApp for sharing data with the lower levels, it's because it is actually more convenient for them for that minute or for the decision they need to make. Over to Isaac, I'm curious to hear your thoughts on this.
Yeah, I think I have typed some answers to some of those questions yet, but briefly, WhatsApp is not yet an official form of communication, the way as far as we know for the Ministry of Health, and it may not really replace the other formal channels of data communications. What it does is that it presents, it has its own potential that I think the system needs to consider, because when you see the staff using it a lot, it means there is a role that it is playing that other channels are not. And as I said earlier, nobody has any problem with WhatsApp for now. Because it's not official, we do not have our data at a higher level to compile that data from WhatsApp. So usually the data from WhatsApp is usually the data that is required now. And when that is done, I think that is the end of it. So the data at the end of the week, at the end of the month, it still comes through the official channel, and that is what is compiled by the system. So I think we didn't have a pushback because everybody, even from the national level, most of us belong to several WhatsApp groups. WhatsApp and Telegram are the two popular ones, and they are being used for many things. So people are really open to using WhatsApp. I think the only thing we haven't done is to look at what else can be done to formalize it, if there is need to do that. Over.
Okay, thanks so much, Isaac and Emilia. We are a couple minutes over, so we just wanted to thank everybody, and we will make sure that we post all of the questions and answers to TechNet. So keep watch out for that. Otherwise, thanks so much for joining us today.
Yes, thank you very much. Everything is going to be posted on TechNet, video recording, presentation, and potentially questions. Thank you very much. Have a great day, everybody. Thank you.
Thank you.
Thanks.